Happy Friday, everybody. Welcome to everybody's favorite show about plastic surgery, health, and beauty. This is Nip Talk. On today's episode, first off, the myth that sunscreen causes cancer. We are going to debunk it. And then Jeff Bezos' fiancée, Lauren Sanchez, plastic surgery rumors all over the internet. We're going to break that down. And then finally, the risk of colon cancer in young people, and it's all coming up right now.
Live from Lincoln Center in the heart of the Dallas Metroplex, this is Nip Talk. An honest and uncensored show about plastic surgery, health, beauty, and lifestyle. With your host, plastic surgeon Dr. Bruce Hermann, and your co-host, entrepreneur and social media influencer Sarah Bennett. Now it's time to discuss the good, the bad, and the ugly of the topics everyone is talking about. It's time for Nip Talk.
Welcome back, everybody. Thank you guys so much for tuning in. I am your host, plastic surgeon Dr. Bruce Hermann, and with me, as always, is Sarah.
Hi.
How are you, Sarah?
I'm good. How are you?
Travis in the box. How you been? Haven't seen you in a while.
Yeah, it's been a little minute, right?
You were on vacation, weren't you?
Yeah, so I went to Horseshoe Bay, Texas.
Oh.
Is where I went to.
Is that like vacation or work?
Yes. No, it was kind of both. It was like a vacation with my other work people.
Gotcha.
Yeah.
Cool.
Yeah.
You missed a good conspiracy theory segment the other day, Travis.
You know what's crazy? When I came back, I saw Doja Cat and I saw, what was it, the Mandela Effect?
Yeah.
And a bunch of other stuff in my profile. I was like, what happened?
Oh.
What happened when I was gone?
Yeah, you missed some good ones, man.
It seemed like it.
Well, we'll have to do some more conspiracy theories.
Yeah.
All right, well, let's just jump into some segments. We're running a little behind today. We almost missed today. That was my bad.
Yeah.
You know, running late with surgery.
That's
Sorry
all right.
to keep you guys late, but so first one, man, we certainly kind of live in an age of medical misinformation out on social media. I mean, I'm sure you guys have probably seen stuff and been like, oh, really? Is that what people are saying? So this one that I have seen lately is pretty wild. Like, it's one of the ones that's just like, I mean, some of the things I'm like, okay, I could see how somebody might think this, but this one is the myth that sunscreen actually causes cancer.
I've heard that.
Have you guys heard this one?
Yeah, it's because of all the chemicals in it.
Yeah. Trey, have you heard the myth the sunscreen causes cancer one?
No, and it's so funny. I'm not a sunscreen user, but going to Horseshoe Bay, I actually put some on.
Oh, did you?
I did.
Yeah, okay.
I did.
Yeah, I mean, yeah, of course, the darker your skin tone, the more protected you are from the sun. But yeah, it's not a bad idea, Trey.
100%.
Well, it can age your skin too, is the other thing. Yeah.
100%.
All right, well, I've been seeing this one pop up, oh man, it's probably been 6 to 12 months maybe. I saw it once, I was like, okay, this is just, I mean, you see stuff on the internet and you see all kinds of crazy stuff, right?
Yeah.
So I don't really pay attention to every little crazy thing I see. But this one kept popping up and I couldn't really believe it. And so, you know, obviously this is not right. Sunscreen does not cause cancer, and I'm gonna tell you exactly why I say that. But you know, sometimes when I see these things, I always wonder who's saying them, right? Mm-hmm. Like, why would someone say something like that? I mean,
to sell something.
Yes, exactly right. So a lot of the times I've noticed on social media, and this goes specifically for the sunscreen causes cancer one, but for other ones too, like these people potentially can profit if you believe it.
Yeah.
Right? So the ones I've seen for the sunscreen cancer thing are like natural health advocates, people selling all natural products, or there are people who just get social media clout from bringing down traditional medicine. That's been a thing since
homeopathic stuff.
Yeah, that's been a thing since the pandemic. So of course, I mean, when you see these things, if not just this one, but other ones, you kind of have to look at the source. And it's funny, you'll see something like this, and then at the end of the social media post, it'll be like, oh, but come buy my products, right? And then you should kind of know that something might be, might
shady.
be up. Yeah. So the next thing would be what is their source of information? And so Sarah, you actually know this. Yeah, that's one of the ones, right? So I'm going to go over these. So the way that this sunscreen causes cancer myth has popped up are three main reasons. And Sarah said the first one is the chemicals in the sunscreen.
Yeah.
So specifically, it's oxybenzone and avobenzone.
Okay.
So those are two active ingredients in sunscreen that actually block the UV rays.
Okay.
So that's good. And so there's actually some studies out there, and they're animal studies, right? So this is not like a human study, because just because something happens in an animal, we don't automatically assume it happens in a human.
Right.
But there are some animal studies where they gave them like these enormous doses of specifically oxybenzone. And I'm talking like 10, 20 times what
Is
you
this
could...
the same people that studied aspartame?
Probably, remember? Right, that was the exact same thing, yeah.
You have to drink like 500
You have to drink like
Cokes.
500 Diet Cokes in a day.
Yeah, to get
cancerous.
aspartame.
So this is
poison.
very similar to that, Sarah. I actually had forgotten that one, but you're absolutely right. So they're giving animals these enormous doses
Yeah.
of oxybenzone, and what it did is it led to some metabolic disruption, which then you could theorize that potentially could increase your cancer risk. So it's not like the animals even got cancer. It's just they
had like irregular cell growth.
Right, correct, right, exactly. But again, at doses that are enormously high, right?
Yeah.
So that's the one with the chemicals that you said. The other one is the theory that vitamin D deficiency is going to give you cancer. And so obviously, well, not obviously, I mean, you guys may or may not know that the sun causes our body to make vitamin D, right? We need vitamin D.
Which is good for us.
Yeah, vitamin D is good for you, right? And actually, vitamin D deficiency is a thing in the United States. I saw one study that said that maybe 25% of people have vitamin D deficiency. And if you extrapolate that far enough, if you have really, really low vitamin D, there is a potential increase in cancer risk. So people are saying, well, if you wear sunscreen, you're not going to make vitamin D and you're going to get cancer. Well, the problem is that sunscreen doesn't block the sun's ability to create vitamin D.
Okay.
Yeah, so it like sunscreen blocks certain things, but doesn't block everything.
Okay.
So whatever biochemical reaction is happening when the sun is creating vitamin D, by shining on you, is not affected by sunscreen. That's been documented in the research.
Yeah.
So that one's debunked. The other one I've seen commonly are with what we call viral anecdotes. So that would be like saying, well, if you look at the rate of skin cancer over the past however many decades, it's actually gone up since people are using sunscreen.
Oh.
Which is true. Okay, that is true. However, this is a classic, scenario where somebody who doesn't really know enough about either research or medicine is trying to, make these conclusions from
like
a
big leaps.
point of fact, right? And so the reason that it's not pertinent is that we're living a lot longer. And people are living much longer than 100 years ago, and the longer you live, the more likely you are to get skin cancer.
Yeah, and there's like so much new medical technology.
Exactly.
You can detect cancer way earlier.
Exactly, 100%, right. And so when people say things like, oh, well, obviously sunscreen's giving us cancer because once we started using it, people are getting more skin cancer, it's just false. Like it's.
Did you find anything about like the aerosol sunscreens? I remember whenever like I had Avery and I was like, doing the whole like obsessive mom stuff that every mom does. It was like aerosol. If your kid breathes in aerosol sunscreen, it's really, really bad for them.
Really?
So there was all these moms that would only use
I know that there's some
lotion type.
question about the chemicals in the aerosol, but I thought it was more environmentally related.
I don't know.
I mean, obviously you probably wouldn't want to huff.
Not use it as like a mouth spray. Yeah.
That'd probably be bad. But no, I didn't see anything specifically about that. And I did pull some research.
Okay.
Because you were asking about that. So there's actually hundreds and hundreds of research articles about sunscreen and its effects, good and potentially bad. There's not really a whole lot of bad, to be honest. But I picked a few, and the summary is that there's no literature whatsoever that says sunscreen causes cancer. It just is not, and it's been looked at.
Yeah.
Like that has been looked at. So I pulled three, really some of the bigger, studies about sunscreen. 1999 Journal of Clinical Oncology, right? So cancer journal, that showed that people that use sunscreen had a dramatically lower rate of skin cancer. Okay. So preventing cancer. 2019 Annals of Internal Medicine. This looks specifically at the long-term use of sunscreen. Not like I went and used sunscreen in Horseshoe Bay with Trey when we were out water skiing or something.
Yeah.
Like I'm using sunscreen every day for a whole summer, all right? Or years. It reduced skin aging, notably.
Right.
And specifically, there was no increased risk of any cancers. Specifically, they looked at that. And then the other big one is a 2021 FDA sunscreen literature review where they looked at like bazillion articles about sunscreen, and their biggest takeaway is that sunscreen prevents, not causes, cancer. So, I mean, the literature on
It does
this...
what it's supposed to do.
What's that?
I said it does what it's supposed to do.
Yeah, it works as intended, yeah.
Yeah. Who
And-
would have thought?
And and the other thing is a plastic surgery. So I do skin cancer surgeries. So obviously I want people to wear sunscreen because I do, all sorts of skin cancers, because a lot of times when people get them on the face, like nobody wants to take them off because they're worried about how it's going to look. Or if it's a big skin cancer, they need reconstruction to close it. So obviously I want people to wear sunscreen, but the other part of my practice is the aesthetic side. I can tell you 100%, if somebody is in the sun all the time and they're not using sunscreen and they come into my office, I know it.
Yeah.
Like I can tell on their skin. It's obvious to me, and I'm sure you probably know what I'm talking about when you see people whose skin quality looks, more aged than it should, and you know that they're out in the sun a lot.
Yeah.
I mean, there's just so many reasons to wear sunscreen.
I wear sunscreen every day on my face. And
Yeah, that's good. That's perfect.
It's like my foundation.
Well,
has
yeah, and
sunscreen
we've
in it.
talked about that when we've done skincare routines. I mean, sunscreen is literally one of the 3 pillars of sunscreen behind cleansing and moisturizer, right? Cleanser, moisturizer, sunscreen. I mean, if you want your skin to be good quality, to be healthy, like you don't want UV light like to be hitting it, whether that be tanning beds or sunscreens. And so, the last thing I said is, or I would say about this is all of the medical societies and groups, so notably American Academy of Dermatology, World Health Organization, the American Association of Plastic Surgery, SPS, everyone is for sunscreen.
Yeah.
So, this is just, it's sad we have to have a segment about this, but, the idea that sunscreen causes cancer is just purely ludicrous. It's like flat earth theory.
Yeah. Well, perfect timing for summer, though.
Right, exactly. And I will say that, as with most of these misinformation topics, it starts out with something that is research that could lead you to believe that, but then it's just extrapolated into something that's just nonsense.
And honestly, like when I was younger, I would just sit out in the sun and not put sunscreen on.
Oh yeah, totally.
Because I wanted to get a tan.
We were dumb. We didn't know any better.
It wasn't because I was like, oh, I'm going to get a sunburn. It's just specifically because I wanted to get a tan.
Yeah.
But honestly, as I've gotten older, I use sunscreen.
And you still
tan.
tan.
I still get tan.
Yeah, of course you do. Yeah, absolutely.
So it's that's a super big myth as well. Because it's I know girls will just not wear sunscreen, or guys will not wear sunscreen.
Because they want to get a tan.
Because they're like, oh, I got to get a good sunburn.
Oh, the burn. Yeah, no, you don't want to get a burn. It's really bad for you.
Yeah.
I read one paper
Super
at
bad.
some point that said that every sunburn you get in your lifetime increases your risk of skin cancer by X amount. Mm-hmm. They figured this out. When you get sunburns, that's worse than just getting out into the sun, obviously, because it's literally burning your skin.
Yeah.
And then your cells are more likely to go haywire and cause a cancer. Mm-hmm. And skin cancer is the #1 cancer in the United States. Yeah. All right. Let's recap this one real quick, Trey. Today we took on the myth that sunscreen causes cancer. Not true. Not true. So this comes from people who typically will profit from you believing that. People selling all natural products, or people who are trying to, bring down traditional medicine. It comes from the misinterpretation of actual research. There are 2 active ingredients in sunscreen that block UV light that were studied in animal models, and that is oxybenzone and avobenzone, that in very, very high doses, I'm talking way higher than you would ever get from using sunscreen, showed to be cause metabolic disruption in animal models, which could potentially increase risk of cancer. So there's never been a link to these actually causing cancer. Other thing that people say is that the vitamin D deficiency could give you cancer. Not true. Sunscreen doesn't block the sun's ability to create vitamin D. And then the myth that skin cancers are much worse now that we started using sunscreen. Yes, we are diagnosing more, but we're living a lot longer and medicine is picking them up. All of the research on this is 100% clear. There's been studies specifically looking to see if long-term sunscreen use causes cancer, and none has been found over hundreds and hundreds of studies. Also, from a plastic surgery perspective, you want to wear sunscreen because the sun ages your skin very, very badly. So if you don't want to get cancer and you want to have good-looking skin and stay young, please use your sunscreen. Summer is coming up. Remember that. Boom.
Yeah, sunscreen equals
Sunscreen.
no wrinkles.
That's right, no wrinkles. All right. This one's interesting. Do you guys know who Lauren Sanchez is? If I just throw that name up there, Lauren Sanchez.
No.
Trey probably knows.
Yeah, she went to space.
That's right, she did go to space.
Is she one of the girls that went to space?
It wasn't the last group with Katy Perry, right, Trey?
Was it the one
Oh,
that?
it was?
It was
Oh.
with Katy Perry and Gayle King and Lauren Sanchez. And, yeah.
Okay, I didn't know she went with that one. Okay,
Yeah.
well, Lauren Sanchez is Jeff Bezos' fiance, but she's
she
also
went
like
to
a person.
space?
Huh?
She went to space.
It was when they send them up in the rocket, and,
then
they
they
don't
just,
really
like,
get
come
into
down.
orbit or anything.
Right, it's like the outer edge of Earth's atmosphere.
Yeah, right. Yeah, Trey, that's exactly right. Yeah, so it's not really like you're an astronaut or you're in space, because there was the whole thing about Katy Perry was saying she was an astronaut, or like you literally sit in the pod and it goes. It's like a ride at Six Flags, but it goes really high.
Yeah.
I mean,
Okay.
it's a little bit more than that. But anyway, all right. I didn't realize she was on that space trip. But Lauren Sanchez is the 55-year-old journalist, news anchor, media personality who's the fiance of Jeff Bezos, the Amazon CEO and founder. And she has been in social media the past week with big plastic surgery rumors, and it's an interesting one. So I didn't know who she was. I had to look her up. I knew Jeff Bezos had some. Did you guys know that they're having like a 3-day-long $10 million wedding?
No.
In Italy? Yeah, it's next month. It's crazy. I mean, I'm going to be
Where's
there.
your invite? Yeah.
Yeah, totally. No. But yeah, that's crazy. $10 million for a wedding. I mean, I know weddings are getting expensive, but that one's out there.
Buy a house
and it's
or
3 days long.
something.
Who wants to go to a 3-day wedding? I mean, that's insane to me. Like, what do you do for 3 days?
I guess look at each other.
I guess we're gonna have to dig into this. We gotta see what happens there. Anyway, she's never admitted to having any procedures, but some recent pics of her were pretty shocking. And you know what? She was a very beautiful girl. Throw up that first pic, Trey. Look at her. I mean, she's just naturally very beautiful. Like, I think she's very stunning looking. Gorgeous, right? So this is her before. Okay. Now throw up that recent appearance, Trey.
Is that like 90s?
No,
Ooh.
that wasn't that long ago.
Ooh.
Yeah, like different, right?
She looks like her. I mean, this is really mean, but she looks kind of melty.
Melty.
Like a Barbie doll that got melted in the face.
Yeah, I see what you're saying.
That's really mean, but I think she looked way better at like the Trump ceremony when he got.
Was she there?
Yeah, there's like this video of somebody like looking at her boobs or something.
Oh, right.
Yeah, Elon Musk.
I remember that. Yeah, I
Looking
remember
at her
that, yeah.
boobs on
Yeah.
camera.
So of course, the internet's making this work. This is what happens with AI now. Throw up that net. So people are making fake pictures of her
Ooh.
now. Yeah, right. So the one on the right was actually circulating around. It's like there's no way that she looks like that. There's no way. And I actually finally found someone that said, "Oh yeah,
Yeah, that looks like the filter that's on Instagram.
Yeah, somebody had faked that one. So the one on the left's real, but obviously that's way, way different than what
She
used
has
to.
a very like petite nose already. Mm-hmm. So it's like, and she has all that extra stuff, like the filler
Right,
on her
makes your nose look
cheeks,
small,
and
yeah.
then her lips. It just makes her nose look
Yeah.
weird.
And
Like she
looks
has like
so
a
good
Michael
before.
Jackson
throw
nose
up,
or something.
Throw up the next one, Trey. There's like a 3-part picture. Yeah, so that's her. Now in the middle one, she's got a little bit of lip filler. I don't know if you can see it's her in
Yeah.
this thing. I mean, she obviously got her boobs done at least once or twice between pick 1, 2, and 3. I mean, 3, that's pretty ridiculous. But yeah, she's changed a lot, and I can't say it's
For the better, yeah.
Yeah.
She looks like a Bratz doll at the last one for sure.
So I guess like what are we looking at here, right? So surgery wise, I mean, I do think she's had at least one, if not multiple, breast augmentation surgeries. Based on that far right picture, the left one could be her natural. It's kind of hard to tell in that dress. I mean, she's had lots of lip filler. I mean, in the first far left picture, it looks like she has none because her lips are kind of normal, like thinnish to average. Mm-hmm. And in the middle one, she's got a little bit of lip filler, and I think she actually, it looks pretty nice. Like
Maybe you're like one of those like little lip flip things.
Maybe. I mean, to me, it just looked like she got the outline done and,
Yeah.
and like a little bit plumper. But on the right side, whoa, man, somebody like needs to put the filler down.
Yeah.
Like that's just way too much. Like it looks so fake.
Too much, yeah.
She's also got some cheek filler for sure. When you look at her cheeks in
Her
that far
eyes
right
look
picture,
smaller, but that could be her
that could be makeup. Yeah, it's makeup, I think. Yeah, I don't think she had eyelid surgery. It didn't look
No.
like it. But she's
I'm saying,
definitely
like,
had
her
cheek
cheeks,
filler.
like,
yeah, like
squishing out.
she's had a lot of cheek filler. I wondered if she had buccal fat removal. Because you see how hollow her cheek looks on that far right picture?
Yeah.
I mean, but it could be...
The way she's like kissing her
It could be
lips.
that, or it could be that she had some weight loss and then the filler above it is just making it look...
Yeah. She's getting old, so doesn't
she's
that naturally
55.
happen? That sunken face look?
Yeah, maybe. I don't know. I don't think she had buccal fat removal. I mean, I think it's probably the filler, and you're right, either aging or weight loss. And then people were asking about facelift. I don't really think she's had a facelift. I couldn't find any point in her timeline where it went,
Yeah.
crazy.
You know whose surgery you need to do next?
What?
It's Kris Jenner. She looks so good.
Really?
And she's definitely had work done, but she doesn't look gross.
Okay, I'll look her
she
up.
looks.
I'll look
She
her up for next
looks
week.
like how like whoever did Lindsay Lohan's face, like did all this stuff
I think
to her.
Lindsay Lohan, we talked about that. I
Yeah.
think she just did like really good.
Well, she's still young and like
non-surgical.
stuff, but
Yeah.
and she's
Yeah.
healthy now. But Kris Jenner, you need to look up
Okay,
all of her
text
stuff.
me. You have to remind me yourself.
She looks really good. It's all. I'm surprised you didn't see it. It's all over like Instagram.
Really? Mm-hmm. Man, I was looking. I didn't see that one.
Yeah.
I may have just skipped over it, but I'll check it. I think she probably has done some lasers. I mean, her skin's pretty tight, so she probably has done some lasers, microneedling. Everyone's doing that now. That's all these celebrities talk. I mean, they when they go on podcasts, they'll talk about it. Oh, I'm doing laser, doing microneedling.
Yeah.
Because it will tighten up your face. Like it works really good. And so I mean, with her, I mean, obviously people are free to do what they want. I personally am not a fan of that look at all. I mean, to me, she looks completely artificial. Like it almost makes her look older. Like you'd expect her to maybe be in her 60s or 70 to look like that.
Trying too
like,
hard.
Yeah, right. Like Madonna. Remember when Madonna went all crazy?
Yeah, she doesn't look like that anymore, does she?
I think her fillers finally wore off.
I think she
Yeah, it
chilled
kind
out.
of evened out. Yeah. Well, she was caught so much flack,
Yeah, she looked.
from like the entire internet about.
She didn't look like Madonna anymore at all.
No, she didn't. Well, that girl doesn't look like she did.
Yeah, it's like it's funny because it's like her before pictures. It almost looks like she's like, oh, she looks like she's like Italian or some type of like,
She does.
something. But now
I assume
it's
she's
just
like some sort of Hispanic with the
Yeah.
last name Sanchez. I don't know if that's. I
Yeah.
guess that's her maiden name. I'm not sure.
yeah, like Spanish, something. But now it's like you don't even like you can't even tell her ethnicity or anything
Right.
because it's like.
Yeah, you can't really tell what's going on.
But that's like something nice about her that makes her special and
Yeah, I
different.
know.
And she's taken it away. Now she just
I
looks
agree.
like
I thought she looked
yeah.
phenomenal.
And now she looks just like every other like
like
plastics,
Mar-a-Lago
like,
face.
desperate
appearance.
housewife type
Yeah.
vibe.
Yeah, I think she just went way overboard. And and I'm a fan of like certain aesthetic things. I'm like, I do think a little bit of filler is good, and I think Botox is good.
Yeah, for sure.
But man, you gotta tap the brakes at some point, and like she just like she went right through.
I mean, if that's what she's going for,
if that's what she's
then
going
that's-
for, it's fine, right?
then
I'm not
she's
gonna like
on
beat her
point.
up. Right.
I mean, and also I guess as long as she's happy, then
I know. I
that's what
just hate to
happens.
see it.
Yeah.
I just hate for people to like look like someone completely different. I
agree.
personally just am not a fan of that.
Yeah, I agree.
Yeah. All right. Okay, Trey, let's recap that. All right, today we're talking about Lauren Sanchez, the 55-year-old journalist who is now the fiancée of Amazon CEO and founder Jeff Bezos. And she was all over social media this past week from an appearance where her look is completely different than what it used to be. And we were breaking down whether or not she's had plastic surgery. And so I looked at some photos. I mean, she's had her breast done, obviously, based on some of these pictures. But in her face, I think she's fallen into the classic trap of just getting too much done. She's got a lot of lip filler in. She's got a lot of cheek filler. It's really changed her facial appearance dramatically, where she almost is unrecognizable to me. I don't think she's really had a facelift, or at least I couldn't find anywhere where there was like a big jump in like her face tightness. She's probably doing the lasers and the microneedling like everyone else, but yeah, I just think she went really kind of overboard with the fillers, and we were talking about how that's just kind of the thing these days for some people, and obviously people are free to do whatever they want, it's their body, but man, I just personally am not a fan of like if you're getting work done and you don't look like the same person. I mean, to me, that's just not great work. So, but if she's happy, good for her.
Yeah,
Yeah, good for her.
that's
All
what matters.
right. Okay, we got another medical topic today. It was kind of a slow week for
For weird things like
Yeah.
conspiracy theories.
Yeah, it was. That was fun. We're going to do that one again. Okay, so I'm going to do a segment on the risks of colon cancer in young people, and this does actually come from a new study that's out, and I'm going to recap that study at the end. Did you guys know that colon cancer is increasing in young people? Have you guys heard this?
No, but I could like see why does it have to do with like energy drinks and things and like the stuff we
We're not
eat.
sure. Trey, have you heard this one? Is this?
No, I have not.
Okay, all right, well, good. Well, every once in a while I pull one out you guys hadn't heard about. So just like a recap of colon cancer, I mean, it is one of the most common cancers in the United States. It's definitely a cancer of more modern industrialized countries. You don't see it as much in more third world countries. In the United States, it's the fourth most common cancer and the second most common cause of cancer death. So every year there's like 1.1 million new colon cancer cases diagnosed, which that's pretty high.
Yeah, and at what age do you have to like do that?
I'm gonna tell you, I've already had mine done.
Gross.
I know, it's horrid. 1.1 million new cases every year and 550,000 deaths in the United States. So risk factors, older age, this has always historically been a cancer of old people,
Yeah.
right?
Yep.
And we're going to talk about how that demographic's changing. Males are more likely to have colon cancer, high intake of fat, sugars, alcohol, red or processed meat, smoking and obesity, and lack of exercise are risk factors. And so, just to give the full information on it, signs and symptoms, this is kind of scary. 50% of colon cancer cases are asymptomatic, meaning like you're just walking around living your normal life and you could have colon cancer. That's half the cases. But in the other half of the cases, people have things like constipation, blood in the stool is the big one for me back when I was in my general surgery days. If you have blood in your stool, you need to like get checked out. Now there's definitely non-cancer reasons that can happen, but it absolutely could be cancer. So blood in the stool, that's a big one. Smaller caliber poops, that's one. Nausea, vomiting, weight loss. So you were asking about how to detect this. So screening colonoscopies used to be starting at 50. That was recently lowered to 45.
Ooh.
Yep. And you're supposed to get
9
one.
years for me.
You got some time? Yeah. You're supposed to get it every 5 to 10 years, depending on risk factors.
Okay.
I would probably do mine. I'm probably going to do 5 for mine, even if I don't have the risk factors, because this is a very curable cancer.
Yeah.
If you catch it.
Yeah.
And it's one of the ones it's not, super obvious. So, and if you catch it late, it's problematic. I mean, it can absolutely.
What about with people like IBS?
That is a risk factor for sure. Yeah. Sorry, I should have mentioned that one.
A lot of people have IBS.
Yeah. IBS, Crohn's.
Yeah.
Crohn's and inflammatory bowel disease, IBD. Wait, is it irritable bowel syndrome? No. Oh wait, irritable bowel syndrome. I don't know. When you said that, I was thinking more the Crohn's and the inflammatory ones. I
know a lot of people that have IBS.
I don't think irritable bowel syndrome is a risk factor for colon cancer. I will look that up, Sarah. I'll get it back to you. But I was thinking like, you know Crohn's, right?
Yes.
Yeah. So that's inflammatory bowel disease. That one for sure. These commonly arise from polyps. They don't just pop up as a cancer cell on your colon. They usually develop in polyps, and so that's why colonoscopies are so important. Yeah, and I actually had one polyp when I got mine done.
That's a normal occurring growth in your intestine.
Well, it shouldn't be there, but they're very common.
Okay.
Yeah, it's like if you get a mole, right? Like you shouldn't have a mole, but people have moles.
Right.
I mean, it's different than that, but what I'm saying is like they pop up as you age.
Okay.
It's not like it's been there forever.
Right.
Yeah, it pops up. All right, so it is notable that the colon cancer in so we're calling young people less than 50. Okay, 50 or less. I had to throw that in there. 50 or less. Young people, that's young, is rising. I actually have a graph here. Throw that up. And so when you look at this chart, it's basically saying how many cases per 100,000 people. And if you look at 20 years ago, around 2005, it was around 4 cases of colon cancer per 100,000 people. And it's not listed up there, but this is less than 50 years old, okay? 50 or less. And then you watch that chart, it's gradually going up. Now, it's not like suddenly 100 out of 100,000 people. It went from 4 20 years ago to like 6.2 But that's a 50% increase in the rate of colon cancer.
What date did they make it to where it dropped to 45? What year?
Oh, that was recently.
Okay.
Because my wife was grieving me because that happened like in between, I was in between 45 and 50 and it happened. And my wife said, you need to get your colonoscopy. I'm like, wait, what? But and they lowered it because the rate's going up. I mean, you can see the graph; it's going upwards. And there's a lot of theories about why that's happening. No one really knows for sure. It's because it's kind of gradual. And in reality, you're talking instead of 4 people out of 100,000, 6 people out of 100,000. I mean, yes, it's gone up, but it's not skyrocketing. It's just going up. But one of the things that's happening now is people are trying to figure this out. And so there's a lot of studies coming out. So there was actually a study from the Journal of Clinical Colorectal Cancer. I got a pic of it, Trey, throw that up there in case anybody wants to go look at this. And I'm going to summarize it for you. So this looked at 25 different studies. It's a meta-analysis review. They're basically looking at other studies to get a consensus. And they were looking at studies that had smoking and alcohol use. Now, we already know that smoking and alcohol is a risk factor for colon cancer. But why this study is different is they were looking at very, very small usages.
Yeah.
It probably doesn't happen anymore, but when I was young, a lot of people smoked when they went out to the bars, that weren't really smokers, call them casual smokers or like a smoke and a drink kind of thing. That was super common.
Yeah.
So they're looking at people like that they don't go buy a pack of cigarettes, smoking. They may smoke a few cigarettes every 2 weeks. And the rate actually was quite a bit higher in that group, meaning even very low amounts of nicotine use, well, specifically smoking, because it didn't look at vape or smokeless tobacco or anything like that. But very small amounts of smoking actually does dramatically increase the risk of colon cancer. And they found the same thing with alcohol. Because historically they would look at people that would drink, 10 beers a day or whatever.
Yeah.
But they started looking at people that drink a drink a day. You go home, you have a glass of wine with dinner, kind of drinking. And if it was pretty regular, their rate went way up. And so that's kind of notable because, historically when I think of people, okay, who's at high risk for colon cancer? Well, the people that drink literally all the time, but that's not true. It's actually people who drink pretty much at all. And the same thing goes with smoking.
That's scary.
Yeah, because there are the pure among us who've never drinking or smoked a cigarette or cigar, but there's a lot of Americans that, maybe every once in a while they do something and now they just kind of have to be aware, especially if they're young people, because this was looking at young people, that increases your risk.
Yeah.
So, it's something I think that is okay. So, I guess the question is, what do you do with this information? Well, I just think that you need to be on top of getting your studies done.
Well, I think it's important to realize all of those risk factors and taking into account, is alcohol more important to you than exercise? Or would you rather stop drinking than exercise? One of them needs to happen.
Tough call. Let's see what we're going to do here.
One of those needs to happen.
Right. Yeah.
Something.
Totally. Yeah.
It's balance.
And it can be overwhelming because there's so many cancers out there, and every one of them's got a laundry list of risk factors, and there's a lot of overlap because a lot of those things that are risk factors for colon cancer are risk factors for breast cancer or stomach cancer.
Alcohol and smoking are just
they're just bad for you.
They're everything. They cause everything.
Yeah, they're pretty bad for you. Yeah, pretty bad. So.
But they're fun, I guess.
I guess people.
There's a time and place for it, I guess.
Yeah, exactly. But I think if you're just aware, right?
Yeah.
Because if you're going to the doctor regularly, you're getting your screenings, at least you're being proactive. And if something pops up, you're going to find it. It's when I went and did my colonoscopy, I had a polyp, and it was benign, but if you let that sit there for 15 years, it could become a cancer.
Yeah.
So what'd I do? I went and got my thing, and they pulled that thing out like it owed them money, and now it's gone. And you can get another one, but the one that you did have that was already there is gone, right? So I think if you're out there I mean, obviously I'm going to tell people never do anything, no vices, right? Like I'm going to tell people, no, don't drink. I mean, no one would listen to you if you ran around and said, no.
Didn't we try to do that one time?
Did I?
No.
Like,
the
right,
United
the dry
States.
January. What were we talking about? Oh, right, prohibition. Yeah. Yeah. So I mean, I'm never going to go out and say that to people, but I just think you need to be aware of the risk.
Yeah.
Like you got to know, like, okay, if I'm doing this, like, what are the potential outcomes, and how can I mitigate that risk? For example, by going to the doctor and getting all my studies.
Yeah.
So, but that's an interesting one. I don't know. I don't make a whole lot. I kept hearing that colon cancer was going up in young people, and then when I looked at the data, I'm like, well, it went from like 4.2 to 6.2 out of 100,000. It's not a huge rise. It is going up. I think it's probably dietary related. I mean, there's a lot of data that shows like certain types of foods increase that, and especially in the United States, we eat like crap.
For sure.
We eat a lot of processed food and things that are going to put you a little bit more risk. So I don't know. I'm not sounding the alarms on that one. But again, colon cancer, like breast cancer, is one of those things. If you get your screenings, you're probably going to be all right.
Yeah.
Yeah, you may pop up with it. You might be that one that gets it. But at least if you're getting screened, I mean, you can cure these things.
Yeah.
If they're early.
And it's crazy because gut health has become such a big trendy topic, and learning what your body needs to be happy,
Right.
because apparently your gut just controls so much of your hormones as well in your body.
I don't know a whole lot about that. I have to look it up.
Apparently.
All right, I'm going to do a quick recap on this one, Trey. So today we were talking about a new study that came out looking specifically at risk factors for colon cancer in young people. And the take home is that if you're even a casual smoker, if you're even a casual drinker, those two things actually dramatically increase your risk of colon cancer, and even getting it at a young age would be considered 50 or less. So I just think people need to be aware of that. Historically, they've looked at heavy users, like people smoking a pack a day or people drinking 10 beers a day. But the new literature is showing, the new research is showing that even small amounts of usage of smoking and alcohol does increase your risk of colon cancer. So obviously, abstaining is always good if you can do it, but I think being aware of that and just going to the doctor, getting your colonoscopy screenings. Now it is 45 years old when you start getting your colonoscopy screenings, because these cancers can be cured, but you got to catch them. And so just be aware what the risk factors are, get your screenings, and you'll be all right. So, all right, good episode.
Yeah, get your butt checked.
Get your butt checked. Thank you, Sarah, for that.
Bye.
We'll see you next week. I'm just ending on that one. Get your butt checked. Bye.